Coronavirus, also known as COVID-19, has changed the world since its outbreak in Wuhan City, Hubei Province, China, in December 2019. Since then, the world has been working around the clock to prevent the spread, as well as get a cure for the new disease.
None of us could have imagined how our world and our lives would be thrown into turmoil by this new virus. The pandemic has brought out the best and the worst of humanity.
Nations witnessed as COVID-19 spread from one individual to the other across continents and was later declared a global pandemic by the World Health Organization. The high rate of new infections and deaths overwhelmed health systems across nations and disrupted livelihoods. Many nations responded with self-imposed social and economic lockdowns in a bid to stop the spread of the virus.
Many countries have implemented unprecedented measures to suppress transmission and save lives.
COVID-19 soon landed in Africa, crowning it a coronavirus last frontier, making the disease a global health threat. Soon after, Kenya, through the Ministry of Health, announced its first COVID-19 case on March 13, 2020.
I want to inform you that the Ministry of Health has confirmed the first coronavirus case in Kenya.
A 27-year-old Kenyan woman who had traveled from the US via London. This case added Kenya to the list of nations fighting against the invisible enemy. Our country quickly adopted far-reaching initiatives and implemented lessons learned from countries that had dealt with COVID-19 longer, as well as some measures that were unique to the Kenyan context. In his first public address on March 15, 2020, President Uhuru Kenyatta directed that all learning institutions be closed, while at the same time ordering public and private sector employees to work from home.
To the guidelines issued encouraging state agencies to establish and implement frameworks for staff to work from home, I also today hereby direct and order that all state and public officers with pre-existing medical conditions and or aged 50 years of age and above, serving in job group S and below, or their equivalents, to take leave or forthwith work from home.
Soon there was cessation of movement into and out of Nairobi, Mombasa, and Mandera. The government further introduced a dusk to dawn curfew, which initially ran from 7 p.m. to 5 a.m.
From this evening, 7 p.m. to 5 a.m. in the morning, there will be a curfew countrywide. The curfew continues every evening until further notice.
Additionally, all Kenyans were asked to self-quarantine, as well as adhere to the Ministry of Health COVID-19 guidelines. Additional measures and directives soon followed to curb the spread, including suspension of all international flights, with exception of cargo flights, mandatory quarantine of people entering the country, closure of bars, and prohibition of sit-in services in restaurants. Further, all public transport was to adhere to passenger social distancing, and all public gatherings and funerals were restricted to not more than 15 people.
Mambo ya corona imetuaffect kwa njia mingi sana, kwa sababu sisi kama mafans wa mpira sana tulikuwa tumezoea kukaa pamoja, kuimba nyimbo za club, tunaimba pamoja tukienda kwa game. Sasa vitu kama hizo siku hizi hatuoni na tumemiss sana kukaa pamoja.
As the battle to stop the coronavirus raged on, it emerged that behavior change was at the heart of prevention and management of COVID-19, prompting the government to adopt a multi-sectoral approach to sensitize Kenyans on the need to adhere to the Ministry of Health's protocols to stop the spread of the virus.
We will continue to encourage our people to visit our health facilities. Do not let somebody die at home because of fear. Do not let somebody who looks sick stay at home, because somebody who dies at home with COVID-19 then can infect a lot of other people. And this disease is not a joke.
The Ministry of Health has developed several guidance documents for continuity of essential health services. Among this is the interim guidance for continuity of nutrition service delivery that provides key recommendations to health service providers during this COVID-19 pandemic. Essential nutrition services provided include early detection, referral, and management of acute malnutrition and other nutrition-related disorders. Other services include nutrition counseling, micronutrient supplementation, growth monitoring and promotion, healthy diet promotion, and integrated outreach services in arid and semi-arid counties.
Despite the mitigation measures, COVID-19 started to spread across counties such as Kajiado, Mombasa, Kilifi, and Kwale, ushering in the community spread phase of the virus. Meanwhile, the world was busy finding a vaccine to help curb the spread of coronavirus. WHO was emphatic that until a vaccine or cure is found, the best way to combat the virus is through regular hand washing, social distancing, and proper wearing of face masks in public places. Months down the line, COVID-19 has changed the lives of Kenyans, both socially and economically, ushering them to the new way of life.
For us, SME, small scale enterprises, bado tunajaribu kung'ang'ana na tunanunua locally. Kwa wale watu wanamwaga mzigo, tunaenda tunanunua locally ili tuweze kuendelea na kufanya biashara kidogo kidogo. Tungependa kama wangeweza kuangusha bei za vitu, zile bidhaa muhimu kila pahali, kama unga, kama mafuta ya gari, zile vitu mwananchi wa kawaida anatumia on daily basis.
Kutoka corona ianze, biashara imeenda chini sana. Juu hata manyumba tunafungiwa.
To cushion Kenyans from the impact of COVID-19, the government rolled out measures to shield its citizenry from the economic shocks, such as 100% tax relief to Kenyans earning 24,000 shillings and below, reduction of payee from maximum of 30% to 25%, as well as on turnover tax rate from 3% to 1% for all micro, small and medium enterprises.
A 100% tax relief for persons earning a gross monthly income of up to Kenya shillings 24,000. Reduction of the income tax rate, or pay as you earn, from its current maximum of 30% to 25%. A reduction of the turnover tax rate from the current 3% to 1% for all micro, small, and medium enterprises.
Other measures included a disbursement of 10 billion shillings to vulnerable groups, beside reduction of VAT from 16% to 14%, effective April 1st, 2020. The government also moved to increase the allocation of funds for healthcare, along with other fiscal adjustments to the economy. This entailed setting aside of 1 billion shillings from the Universal Health Coverage Kitty towards the employment of new health workers to help combat the spread of COVID-19. Kenyans have demonstrated remarkable resilience in combating the disease, and it is emerging that fighting COVID-19 is a collective responsibility. Health experts advise that Kenya is not out of the woods yet. However, with active participation and adherence to directives and measures to combat coronavirus, Kenya will eventually flatten the curve. Komesha Corona, okoa maisha.